Sympathetic depressants. Sympathetic tone arises from vital center in the vasomotor center, then it passes through sympathetic ganglia, then sympathetic nerve ending to release noradrenaline, which acts on alpha and beta receptors. To decrease sympathetic activity, we have receptor blockers, adrenergic receptor blockers. We have drugs which block beta, drugs which block alpha, and we have drugs which block both alpha and beta. Or adrenergic neuron blockers. These are drugs which act in sympathetic nerve ending to prevent release or deplete stores of noradrenaline. And you can get drugs which inhibit synthesis of noradrenaline. Ganglion blockers. But ganglion blockers, they will block both sympathetic and parasympathetic ganglia. And finally, central sympathetic depressants. These are drugs which inhibit sympathetic tone originating from CNS. Group of drugs which are alpha-2 stimulants or alpha-2 agonists. Beta blockers. They compete with adrenaline for beta receptors. Pharmacological actions. Heart contains beta-1. Beta blockers will decrease all properties. Decrease contraction, negative inotropic. Decrease heart rate, negative chronotropic. This will decrease cardiac output, decrease myocardial work, and decrease myocardial oxygen consumption. Also, they decrease conduction, it's called negative bromotropic, decrease excitability, and decrease automaticity. They produce hypotension on long use in hypertensive patients due to decreased cardiac output and decreased renin. So they are very effective drugs in treatment of essential or primary hypertension. They decrease intraocular pressure, mainly by decreasing aqueous humor formation. So they can be used in treatment of glaucoma. They decrease intraocular pressure without affecting behavioral signs. Bronchi, drugs which block beta-2 induce bronchospasm, especially in asthmatic patients. Metabolic actions inhibit glycogenolysis induced by sympathetic stimulation, block hypokalemia induced by beta stimulants, and inhibit lipolysis. Some beta blockers are partial agonists. They stimulate and block beta receptors, and others are antagonists. On CNS, beta blockers which can cross to brain reduce anxiety and reduce tremors. Weak local anesthetic action with some beta blockers due to blocking of sodium channels. This is called membrane stabilizing action. Therapeutic uses in angina pictures. Beta blockers are used for prophylaxis of stable or effort angina by decreasing myocardial work and decreasing oxygen consumption. But they should never be used in variant or rest angina which are due to coronary spasm. They are used in treatment of arrhythmia, either atrial arrhythmia or ventricular arrhythmia. Treatment of hypertension, primary or essential hypertension. They do not produce postural hypotension. They are used with alpha blockers in treatment of pheochromocytoma or in management of pheochromocytoma, but not used alone in pheochromocytoma. In treatment of glaucoma, we use timolol, prophylaxis of migraine headache, in anxiety and tremors, and in thyrotoxicosis to control some manifestations in thyrotoxic patients, as anxiety, tremors, and tachycardia. Adverse effects. Due to reduced contraction and cardiac output, they may induce heart failure, bradycardia and marked decrease in EV conduction reducing heart block, decreased blood flow in periphery leading to cold extremities, and this may lead to gangrene, hypotension, bronchospasm with drugs blocking beta-2 receptors, increased effect of insulin in diabetic patients, and mask hypoglycemic manifestations except sweating, which is mascara. Hyperlipidemia, the increased triglycerides and decrease HDL cholesterol. So they cannot protect against atherosclerosis. Sedation and sexual dysfunction, and sudden stoppage may result in angina, arrhythmia, or infarction after long use. This is due to upregulation of beta receptors or increased sensitivity of beta receptors on long use of beta blockers. Contraindications in patients with heart failure, in bradycardia and heart block, in variant or rest angina, and in peripheral vascular disease, in hypotension, they should not be used alone in phagocytoma. They are combined with alpha blocker. Bronchial asthma, don't get non-selective beta blockers. Diabetes mellitus, and sudden stoppage. This may result in angina or infarction or arrhythmia. Members of beta blockers, we have non-selective beta blockers, we have cardioselective beta-1 blockers, and you have alpha and beta blockers. Non-selective beta blockers, they block beta-1 and beta-2 receptors as propranolol and timolol. They should never be used in asthmatic patients. Cardioselective, they block beta-1 more than beta-2 as atenolol. We have drugs which block both alpha and beta receptors, which is labetalol.